The RCP is a brilliant organisation, but after a difficult year, it needs a fresh start. My name is Tom Solomon, and as president, I would bring extensive senior leadership experience, plus the energy, enthusiasm, and commitment to deliver the changes needed. I'm director of the Pandemic Institute and professor of neurology in Liverpool, where I have inpatient and outpatient responsibilities, and like you, I'm seeing an NHS struggling to cope. We need a strong RCP, but the college has been at its weakest with the Physician Associates crisis leading to the resignation of the president. A damning report from the King's Fund criticised the RCP's senior leadership, governance and culture. I've been on RCP Council since 2019, so I understand how the college works and what needs changing. I became academic vice president in August 2024, soon after the last president resigned, and I've worked with the senior leadership team to steady the ship, plus take on responsibility for communications, policy and research. But we need to do much more than that. As president, with your support, I will, 1, reorganise the college to make it more efficient and focused on the key issues identified by members and fellows. 2, work tirelessly to improve employment conditions for all doctors and drive a national review of resident training. We mustn't lose a whole generation. And 3, bring together UK and international members and fellows to address the major issues facing the medical community, including climate change and health, AI and digital, plus reforms in healthcare delivery and equity. How do I know I can do this? Well, I bring an extensive portfolio of senior leadership experience from roles outside the RCP, in academia, the NHS and other major stakeholders. I've led organisational change, for example, as Institute Director and Associate Pro-Vice-Chancellor at the University of Liverpool. I've managed multi-million-pound budgets, achieving year-on-year growth, for example, as Director of Liverpool's Institute of Infection and Global Health. I've worked with ministers and senior civil servants at DHSC and NHS England as a national leader in emerging infections. Plus, I have extensive media and communications experience with countless appearances on TV and radio, my Scout Science podcast, and sell-out Edinburgh Festival shows. I know how to get my message across to different audiences. So, if you want a president who's gone head-to-head with the Health Secretary on BBC One's Question Time to speak for you, then vote Solomon. If you want a president who can work with our brilliant fellows, members and staff to create a dynamic, proactive, outward-looking RCP, vote Solomon. If you want a modernised and fit-for-purpose college at the forefront of medical training and healthcare delivery to improve the NHS for patients and the public, vote Solomon. If you want to use your vote wisely, vote Solomon. Thank you.